Well, there are concerns that the 2021 local government election campaigns currently underway across the country could pose a threat of a COVID-19 super spreader. This has reportedly caused concern among scientists who say this could lead to an early fourth wave of COVID-19 infections, thousands of deaths, and the possibility of the country spending the festive season under a hard lockdown. Experts say President Cyril Ramaphosa's recent easing of lockdown restrictions, which include an increased number of people who can gather, may backfire. Let's speak to the National Health Department's Acting Director General, Dr. Nicholas Crisp. Great to have you, Dr. Crisp. Thanks for being with us this morning.
Morning, Leanne. Nice to be with you, and morning to the viewers.
So obviously we're seeing the numbers coming in, the official reported numbers. They're getting lower all the time. The positivity rate is below 5%. I think this morning we were reporting it's at about 3.7%, which is showing that it is under control. However, we still are in the middle of a pandemic. What is the Department of National Health's observation of the country's adherence to these COVID-19 regulations, especially during the period of political party activities?
Yeah, Leanne, thanks very much. So I think what we find is that people are very tired of the lockdown. They're very tired of wearing masks. They're tired of being locked up in their homes and not talking to one another and seeing their families and so on. And this is very understandable. We are social animals and we like to get together with others and in an environment. So we need to do whatever we possibly can to protect ourselves. The first one is, of course, to maintain our social distance and to maintain our mask wearing and hand washing, stay in ventilated places. And the big thing is to stay out of crowds as far as possible. And that's obviously a challenge when elections are going on. But we have seen other countries run successful elections without too much of a problem. And we are between waves at the moment. So we've just really got to encourage people to preferably not get involved in the large crowds, but where they do, stay far apart from one another and preferably stay in outdoor spaces, not in the indoor spaces.
Everything you're saying and all those rules you're putting in place are almost impossible when you put your mind into an election campaign or any political party campaign. There are thousands of people gathered together right on top of one another, and very seldom do we see masks being worn. And, this is a time where political parties come out and try and gain the voter and try and get people coming in. And now with the president having sort of upped the numbers of outdoor events to 2,000, there must be a great concern from your side.
Yeah, well, I think that from a public health perspective, the concern is any form of gathering. We gather, that's what we do. People go to places of worship and they want to be in large groups. We go together to sports events and we want to be together in large events. It's almost inevitable that it's going to happen. So I don't think you can prevent it from happening. Even if the regulations were for lower numbers, people would still come together in those sorts of numbers. So obviously it's an anxious time for us, and we hope that the transmission rates are very low and that there's sufficient immunity amongst those who are attending these events to reduce the transmission. But this is not an ideal thing to be doing during a pandemic.
Yeah. Let's have a look at the vaccination rate, because we know that there was the whole Vuma vaccination weekend that was held nationwide. I think we managed to get about, I'm not sure the exact number, but I don't know, somewhere between 350 and 370,000 shots over the weekend. What are your views on how we are doing with the vaccination rollout?
Well, not as well as we would like, obviously. We've worked very hard between ourselves in the public sector across the provinces and the private sector colleagues to build the capacity to vaccinate a lot more people than are coming. So we are able to vaccinate at least 300,000 every day. We have the vaccines to do that, but there seems to be either a hesitance or an apathy about coming for vaccination. In the beginning of each age cohort that's rolled out, there have been very good turnouts, and then it dwindles quite quickly after that. And that's disappointing because you have to work harder and harder to get to more and more people. We are nowhere near the kinds of coverage we would like to be. But there are encouraging parts of the vaccination campaign, particularly that the 60-plussers, who's our most vulnerable population and the people in the community that we really would like to vaccinate the most, have been coming in very big numbers, and we are now over 60% of that population vaccinated. Even the 50-plussers, which is also a very vulnerable community, we are now over 50% and in some places over 60%. That's very encouraging. I mean, the Limpopo province is already on 72% of their 60-plus population vaccinated. These are the encouraging figures. And we just got to work at getting the broader population in the younger age groups to also vaccinate, and not just older people.
Yeah, and that's a very important message to be putting across. I mean, we do know that we saw some numbers coming out and stats from, I think it was out of the Western Cape, and I know I'm bringing up something that I'm sure most people have heard about, but let's emphasize it again. I mean, they were talking to the hospital statistics and those that were in hospital and in very sort of ill circumstances were unvaccinated. Very little that were vaccinated are in hospital care. And that's the message to get out there. It's not that you're not going to get COVID, but it's the severity that you will get it. And that's what I think what people need to understand. I mean, is that the big resounding message you're trying to get out there?
Yeah, so I mean, we're now watching those statistics very closely, and across the country, everywhere, it's less than 20% of people who end up in hospital at all are vaccinated. So there must be some protection that seems to us to be very obvious. And when we look at who those 20% are who are vaccinated, the majority of them have not completed their vaccination schedule, so they are a little bit more vulnerable. But they are not ending up in numbers in ICU, and they are not ending up in numbers in high care. And what is even more important is, as you've heard some of those statistics that you've quoted, there are whole periods where there are no vaccinated people in intensive care units in some hospitals, and there are no vaccinated people dying. That's what we want. We want to protect people so that even when they get the illness, it is very mild and it passes without doing any damage.
One of the, I think, sticking points, and perhaps you can talk to us a little bit more about this, is the Johnson & Johnson vaccine, because this is a vaccine that for the kind of areas that we have here in South Africa, far outreaching rural areas where, unfortunately, to get to these people that are living there that need to have the vaccine, to get them twice to a vaccination site is almost impossible. Once is perhaps a little bit more doable. But what's happening there? Because we know Johnson & Johnson is one shot and Pfizer is two shots, but do we still have the shortage of Johnson & Johnson? If so, why, and how are we addressing it?
Yeah. So, I mean, look, we're fortunate to have two very effective vaccines that do the job pretty well in South Africa at the moment. And we are fortunate that Pfizer has been delivered right throughout. So we have managed to maintain a campaign. But we have definitely had problems in getting a sufficient Johnson & Johnson vaccine to manage our campaign. And I think everyone knows the history of what happened. There was a global problem with the production, with contamination, which led to a global shutdown almost of delivery of Johnson & Johnson vaccine. And that has not picked up and not been stabilized yet across the globe. Our president has been involved in this process with Johnson & Johnson, talking to the European Union. We have all been involved from a technical perspective, working with them. We have meetings every week to find out what's going on and where we are in the program. We are not the only ones who are trying to source the vaccine. It has picked up. We have received a few deliveries, and we are pushing those into rural areas and into our SASSA pension pay points in particular. And we are expecting another 1.4 million doses this week. There probably won't be another delivery next week, but if we are fortunate, then the schedules will pick up again towards the end of October through November and December. So we hope we will get the Johnson & Johnson vaccine, but in the meantime, we have plenty of Pfizer vaccine, and so we would like people to come forward and not wait for that dose.
Yeah. So let's have a look now, going back to the lockdown restrictions. And, it's understood that some experts say that the easing of the lockdown restrictions, allowing bigger numbers, as we've said, I think 750 indoors, 2,000 outdoors, may backfire, and the country may see a spread of infections and unnecessary deaths. I imagine that the department is concerned of the flouting of the regulations that comes with the relaxation of these lockdown measures.
Yeah, look, I think people have flouted the lockdown regulations all the time from the beginning, but not everybody does that. There are a lot of compliant, the majority are compliant, but it's been very difficult. We've seen pictures of people getting into taxis without masks in the beginning, and we see fewer of those now. So, I think that we are monitoring the situation and will monitor the situation, and in the decision making, we are told that immediately we raise the flag, then we'll have to relook at those numbers. Any crowds are difficult to contain this kind of a spread. Mm-hmm. But at what point do you shut down your economy and your life forever? So there are risks involved. There are those who are pushing for a complete lifting of everything and saying, let's go back to life. Let's open all the stadiums, let's open all the places of worship and so forth. That's probably a little bit too early for that. So there's a balance. Who knows what the magic number is? I think that we now have a number. It is set. Hopefully those who are organizers of these events and proprietors can do their best to contain the numbers. And we will have to monitor the situation to see what's happening.
Yeah. I also, we hear obviously different calls from political parties. I mean, we see the DA calling on the president to end the lockdown and lift the state of disaster with immediate effect, basically contending that there is absolutely no scientific or moral justification to continue with the measures that have long since been ignored by parties during this particular period. So what's the latest from the department and advice from experts and government on this particular matter?
Well, look, I think we know that we're headed into a fourth wave at some stage. So one does need to have legislation in place that can deal with that, and whether the other legislation, other than the disaster regulations, will be able to manage the fourth wave is a moot point because we haven't been there. From our perspective, we have a number of ministerial advisory committees on vaccines and on the rollout. The Ministerial Advisory Committee was cautious but did recommend that we should go to a level 1 and not remain on level 2. They do make some detailed suggestions inside, and they did give a very specific guidance on what to do for election rallies, and they gave guidance to the IEC, and those are all based on the WHO guideline documents. So the IEC is very aware of what is in those recommendations, and they have been following what has been suggested from across the world from other people's experience. So, you live with the best that you can do with. You can't go forever with doing nothing. And I think that we are going to just do the best we possibly can to step up vaccines, monitor what goes on in crowds, and to deal with the patients who do end up in hospital.
So let's have a look globally now and talk about any variants of concern. I mean, we would watch, once particularly the Delta variant was starting to take grip of India and then, of course, the rest of the world, and then came to South Africa. And it was, I don't think anybody imagined the extent of that Delta variant and what it did to South Africa. I mean, the president addressed that also when he was speaking to us last week. But are there any other variants that we're keeping a very close eye on, that the world is worrying about right now?
Fortunately, we don't have anything of concern in South Africa at the moment. The scientists report to us on basically a daily basis, and they publish the stats on a global watch every day as the results become available. And that's how we share information around the world and know what's happening long before it arrives on our shores. There are variants of concern in other countries that one just has to watch and make sure we don't detect them here. But right now we are almost 100% Delta variant in South Africa. There's been the C12, which has been watched for some time, and occasionally they are picking up in the sampling that where the results come out, we get one or two C12s. But there's pretty much nothing else on our horizon at the moment. The big question is, what will the next variant be? It may not be something that is visible anywhere across the world at the moment, like Lambda, which is in other countries. We don't have any cases of Lambda, and we haven't had any in South Africa. So at the moment, we are dealing with a purely Delta epidemic, and we are able to control and contain that. And our vaccines work very effectively against it.
Yeah. So again, that debate about the UK keeping South Africa on the red list, but it looks like there seems to be some developments. I can imagine that this is just something that is for South Africans that have been vaccinated and traveling overseas and still being on a red list, and the talk about the beta variant. I mean, this was just. I think this was a very unfortunate thing. I mean, from what we've been reading and understanding. From your perspective, I know scientists have been in conversation with UK scientists and the president as well as the prime minister in discussions. I mean, this is, again, what they call apartheid, vaccine apartheid. So talk to us about this.
Well, I was also in the meetings with the UK scientists. Unfortunately, our scientists and the UK scientists, like most of the senior top scientists around the world, all know one another anyway. And so it was a cordial discussion about, why did our information not pass muster? What is their process? How do they evaluate? And we learned quite a bit of information. We learned that they evaluate more than 260 countries on an ongoing basis. We also learned that they only review those countries where there's large movement, 10 to 20, they said, in a 3-week cycle, where there's large movement in the types of variants that they are seeing across the country. So we may have just been off their horizon at the time. But whatever the reasons were, we are in very close contact. We talk, some of us every day, to either the High Commission or the scientists directly to one another to provide information, make sure we're all on the same wavelength, and that we don't miss one another once again. So, I mean, that's from our perspective, from health. There are other issues related to tourism and trade. And as you rightly said, the president has informed us that he has had a discussion with the prime minister. So we wait now in the 3-week cycle to hear what happens.
Yeah.
But, even that tourism and people moving around, you're getting into airplanes, you're moving in close spaces, you're moving into airports, there are crowds. You do have to be very vigilant. You have to watch what is happening, and you do have to protect that people who are moving in and out of your country are not going to spread the disease.
Yeah, certainly. I mean, that's, complacency, unfortunately, is what can lead to more outbreaks. Now, just 2 more questions before I let you go. We've spoken vaccination. Is there any discussion within South African government about now introducing lower age groups into the vaccination campaign, like you're seeing in other countries from 12 years and up? Is that something on the radar for South Africa?
Yeah, very much so. So the question is about timing, not about whether to do it. So what we need to do is we need to have the regulator approving a vaccine that can be used in children, and that has been done. So Pfizer vaccine is approved for use between the ages of 12 and under 18s, and will be rolled out. And the question is when to do that. And we have been, as you know, attacking our challenge here one age group at a time. And there's every reason to expand it to children soon. So when that soon might be, I don't know, whether it's during the month of October or whether it's in November. There is an intention to expand our vaccination program. We have to get to the risk populations first, and that has been our strategy up till now.
All right. Well, we'll have to have a really full-on conversation about that when that's made. I'm sure, as myself, nervous parents out there just, wondering, having lots of questions about sort of administering it to 12 years old. But let's leave that one and we'll open it up once that sort of announcement is made. Then finally, Dr. Crispers, I'll let you go. This 4th wave, you've been referring to it, the whole interview. We've all been sort of, holding on, thinking, okay, everything is fine now. But there are those predictions that December, round about then, that, things could start getting a little bit hair-raising again. Is that still when we are expecting a 4th wave? I know it's very hard to predict, but is that the time frame?
Well, if we had a crystal ball, I think we would solve this very quickly and we'd all know exactly where we're going. From our perspective in the health sector, we know it'll come. if we are naive, we could say, well, maybe it will be delayed into the new year. But the pattern that we've seen so far suggests that we should expect another wave this year, and we could expect it in December. That would obviously not spoil Christmas and the holidays and so forth, but that's where we have movement of people, even bigger than what we expect during elections. We will have had the elections behind us. We will have had the occasional matric parties, which are definitely going to spread just as much as any other gathering. So, I think from our perspective, we know that it's coming. What we need is for our health professionals to rest now while they can. We need to get our oxygen sorted out, prepare ourselves, get our stocks in place, because it will come. Exactly when and what it'll look like and what form it's going to take, we don't know.
All right, we leave it there. Dr. Nicholas Crisp, thanks so much for talking to us. Acting Director General for the National Health Department, discussing the precarious position that the country may find itself in if COVID-19 regulations are not adhered to as local government elections approach amid the COVID-19 crisis. All right.